Hello and welcome, everyone. Thanks for joining us for our February Choices Community of Practice Coffee Chat. The topic for today's coffee chat is engaging community partners in health improvement planning. My name is Molly Garrone, and I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. And it's my pleasure, as always, to be facilitating today's event. I would like to acknowledge our funders who make this work possible and also mention that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate. We are not looking to influence any specific legislation. If you are unfamiliar with the Choices community of practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And we aim to support these efforts by providing tools, resources, and trainings. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. So for today, we will start by hearing a brief presentation from our speaker, and then we will be opening it up for a full group discussion and Q&A. And we encourage all of you to share any questions or comments in the chat throughout the event today. For today's coffee chat, we are looking forward to learning more about resources that can support engaging community partners in health improvement planning, specifically some new resources available through MAPP 2.0. The MAPP acronym stands for Mobilizing for Action Through Planning and Partnerships and is a community-driven strategic planning process to achieve health equity developed by the National Association of County and City Health Officials, or NACCHO. And we are fortunate to be joined today by Anna Clayton from NACCHO. Anna is a senior program analyst at NACCHO and has been working with their team for the past 4 years. Anna leads their MAPP portfolio for community health improvement, and she has been working with the MAPP team at NACCHO to update the MAPP framework, including its guidance and trainings, and provides MAPP trainings and technical assistance to members. Prior to NACCHO, Anna provided capacity building assistance to local HIV organizations in Washington, D.C. I'd also like to acknowledge this is Anna's second time presenting during one of our coffee chats. We were really lucky to have her join us in February of last year to talk about the MAPP framework and how it could support community health improvement work. So welcome, Anna. It's so great to have you back with us today. And I'm going to hand it off to you to get things started.
Great. Thank you so much, Molly. Thank you all to your team for having me back and inviting NACCHO to share about tools related to power and partnership building in MAPP 2.0. It's great to see everyone here joining today. I'm recognizing some names of individuals who have participated in our first MAPP 2.0 in-person training, so welcome. Good to see you here. So I will be sharing about a specific tool within MAPP 2.0 called the Power Analysis on Community Health Improvement Plan Priorities, and applying it to an example that you all hopefully will find relevant. So if you're not familiar with NACCHO, NACCHO is the National Association of County and City Health Officials. We are the membership organization for the nation's nearly 3,200 now local health departments. NACCHO provides resources, technical assistance, training, and advocacy for local health departments and their community partners. I mainly work with our MAPP portfolio for community health improvement, which we'll focus on today. These are our objectives for this session. So I'll provide a little introduction to MAPP 2.0, talk about how we address health equity through MAPP and how power is integrated into that, explain the purpose of this specific activity, the power analysis on CHIP priorities, and apply the power analysis to a healthy eating policy example. So beginning with a basic introduction to MAPP. MAPP stands, as Molly said, for Mobilizing for Action Through Planning and Partnerships. And it's the National Association of County and City Health Officials flagship framework for community health improvement. It outlines a community-driven strategic planning process to improve public health and advance health equity. MAPP helps communities prioritize public health issues, identify resources to address them, and take action through a shared community health improvement plan. Typically, MAPP is facilitated by community health leaders like local health departments, nonprofit hospitals, health centers, or a combination of all those, although it can be facilitated by others, and it provides a structure for communities to involve the broader local public health system and non-traditional community partners, meaning those who we might consider outside the lens of traditional public health and healthcare. MAPP 1.0 was originally developed in 2001, and from 2018 to 2023, NACCHO updated the framework in response to a national evaluation and lots of input from the field, with the goal of making it more community-driven and to center health equity as the central goal. So you can read much more about MAPP 2.0 and see the resources at nacho.org/MAPP, and I'll speak to those in a little bit. So to set the stage for the topic today, I'd like to share how we focus on health equity in MAPP 2.0. So we use the definition from Dr. Kamara Jones, which I don't have here on the slide, but we use the definition that health equity is the assurance of the conditions for optimal health for all people. This health equity action spectrum was created for MAPP 2.0 to outline the relationship between root causes here on the left, social determinants of health in the middle, and health outcomes and behaviors, and how they all interrelate. So at the individual level on the far right side, we might note that community health improvement helps us prevent mortality, address health outcomes, and provide resources and education to improve health behaviors. Those are driven in large part, as we know, by social determinants of health. So the framework used here outlines physical conditions, social conditions, economic conditions, and service conditions of communities in which we live and work. And to go a step further, the status of those conditions is driven by underlying root causes. So root causes listed here are things like racism, ageism, nationalism, etc. Those stem from a root of the myth of white supremacy, and they create hierarchies of privilege and oppression, which lead to imbalances in power and access to power and generate social injustice. So obviously, there's a lot to dive into here, and this is a resource within MAPP as alongside additional health equity education resources that can be used by communities implementing the process. But the takeaway for today is that we are exploring this full spectrum of root causes to individual health outcomes in a community health improvement process and need to take those power imbalances into account. So we'd like to engage you in a brief reflection question to kick off this conversation about power. So would you please share in the chat what words come to mind when you think about the word power? And there's no right or wrong answers here. Great. Influence, money, control of money. Very tangible things here. Great. Strengths, authority, inequity, wealth, corruption. All right, some strong words here. Great. Thank you all. All right, we can go to the next slide, please. So what you all just contributed illustrates lots of associations with just the word power alone. But how do we define it in relation to community health improvement? We use this definition by Dr. Martin Luther King, that power properly understood is nothing but the ability to achieve purpose. It's the strength required to bring about social, political, and economic change. So power in and of itself, as we're looking at it here, is not good or bad. It's simply the ability to achieve a purpose. The purpose of community health improvement overall is to improve health and well-being. So it's important for us to consider some questions like, how do we leverage power to achieve that purpose? Whose power can we leverage? What powers does the health department have? Do each community organization involved have? What powers do communities experiencing and negatively impacted by inequities have? And how can we build support for those who do have decision-making power to support our purpose or to support policies and decisions that will improve community health and well-being? These are some of the questions explored in MAPP. And the purpose of the tool that I'll introduce now is to help you identify who has the power to affect change on a specific issue of interest and who is aligned in the change that the community seeks so that you can engage them for maximum impact. So this brings us to this power analysis tool on CHIP priorities. A community health improvement process includes assessment, from which community health issues are identified and prioritized, and the issues that the community selects to focus on are put into the community health improvement plan, which is then implemented. The purpose of this analysis is to identify who to involve in addressing the priorities from your community health improvement plan based on who has an influence on the issue and who is impacted by the issue. The goals of the power analysis are to assess the systems, organizations, and people who have an impact on the priority issue, identify whom the issue affects most and where there's opportunity to build their influence, and identify factors and people perpetuating the problem. You could use this analysis if you're not working in community health improvement to help you identify who to partner with on an issue of interest to address, even if it were outside of a CHIP. And this is a tool that's adapted from Human Impact Partners' Power Analysis tool, which we highly recommend exploring, as well as their other resources. So to give you a little more context on when this is used in a community health improvement process, this is not an official diagram from MAPP. This was just intended to try and summarize where it shows up in the process. So some key steps within MAPP. First, you start by gathering partners and community members who are going to engage in this community health improvement process altogether. Everyone, including community members, sets a vision for the healthy future. That's the vision that you're working toward in community health improvement, and the assessments that you conduct next tell you how far your community is from that vision. Based on the assessment data, the community identifies what the priority issues are to address that will have a great impact on improving population health and prioritizes those. This is the step where this power analysis comes in. So now you've taken all your assessment data and narrowed it down to, let's say, 4 to 6 issues that your community will address with the partnership of other organizations over the next 3 to 5 years or even longer term. So this tool is used to identify who should be involved in that work before you go ahead and implement that work. The power analysis involves the following steps. First is to identify those who could positively or negatively impact the success of the work on the priority issue. Second is to analyze each stakeholder according to their power and influence over the issue. And third is, based on that information, determine who to engage, especially those who support the issue with power to affect change. So digging into step 1, this is where you identify who has power in relationship to the issue and who are our partners and opponents. So looking at who has power, this does speak to what a lot of you, or what all of you put in the chat as far as who can affect change, who has influence, authority. That's exactly right here. So here you're taking stock of who people and organizations, who has the ability and resources to make an impact on the change that we seek. It could be positive or negative impact. And these might even be the people who you ultimately need to target to make the change. So these are people and organizations who have authority over the change that you seek. Second is partners. Who is aligned with you on this issue? Even if they don't have the power to affect the change, who are going to be your allies? So these would be those who are also looking to make a change because they are impacted by the issue, or it could be other organizations who agree on the need for action. They might already be working on the issue, and they can provide support potentially to help you make progress. Next are opponents. So who is not aligned? These are the groups that want the opposite of the change you are looking to make, or just don't want to see this progress that you're seeking. These would be groups who are going to be impacted negatively by the progress that you seek, or they just might disagree on the need for this specific action. And they may or may not have ability to derail the efforts. But these are who you want to be aware of if they do have power to impact and they are opponents. You want to be aware of that as you're moving forward and try to mitigate that. And partners who have power to impact are who you're really looking to focus on engaging. So the last thing I'll note here is that all of this is taken into account based on the priority issue you're trying to address. So power here is contextual. It's not who has power in the community overall, but who's really going to have power related to this specific issue. So now that you've identified those people and organizations, you would complete this information to understand their relationship to the issue more deeply. First, you just name who, this is what's on the power analysis worksheet. So you name who the organization is or this person is. How are they impacted by the issue? So how does it affect them? And this will also help speak to their potential interest in addressing the issue if it impacts them. What their relevant powers are. So what type of power do they have related to the issue? This could be formal or informal power. So formal power, this would involve people who have resources at their disposal, or as you were mentioning in the chat, they have that authority to make a change. Informal power, these are the groups and people who maybe don't have a given authority over the issue, but they might have some kind of influence in the community, and people look to them to see maybe whether to support an issue or not. Next is accountability. So we could say that we're all accountable to the organizations that we serve. So for example, I don't make decisions about the work that I do totally independently, right? I'm accountable to NACCHO. That's who my time is for, who I work for in this role. So you have to think about the people that you're targeting, who are they accountable to? And similarly, but different a little bit, is who ultimately influences their decision. So what's important about that is that you might be thinking about a specific organization that serves a specific subpopulation in the community, but they're ultimately influenced by their funders, for example. So the point of this is to put into very real terms who influences this organization so that you know what's going to ultimately impact how they interact with the work. So bringing this into a fictional example, but hopefully relatable, let's pretend that we're all members of the Sunshine County Health Coalition. We are made up of health departments, health centers, community-based organizations, businesses, and we all have a shared goal of improving community health. We've decided that we are going to work toward this goal. By 2025, we want to implement a district-wide policy to serve healthy school meals for all at no cost to all students. So step one of the analysis would be to identify who has power to affect this change, who will our partners be in this effort, and who will be our opponents. So just maybe we can get some input on the chat. Who in a local community or a set of maybe a few counties, who would have the power to affect this change of implementing a district-wide policy to serve healthy school meals for all? All right, school board, schools, school admin, Board of Education. Great, perfect. So you all are thinking like a little step higher here. Awesome. Great, food service director. So there might be multiple different groups that have an impact on this. That's great. Who would be your partners in this effort? Who do you think would be aligned on wanting this to happen? Parents, the health department, of course, PTAs, PTOs, parents. Who might be our opponents in this effort? Who would be against doing this? This one might be a little harder. Potentially political groups, current food service vendor, food service companies, local businesses. Great. People who don't like to pay taxes. Right. So it could just parents and kids. Yeah. So it could just be a question too of maybe who wants to see that funding go in a different direction and they don't want it to go to this. So I think that you all brought up excellent points. All right. So next slide, please. So this is just to summarize the types of questions that you would be asking. Sorry, a little confusing. So we are Sunshine County Health Coalition. We're going to pretend that we've identified Sunshine County's Children's Health Solutions as an organization who could be a partner in this effort. We'll imagine that they are a local chapter of the Food Resource and Action Center National Advocacy Group who advocates to see this priority realized. And these on the right would be those questions in the analysis that we would want to answer about them. So on the next slide, please. So here is an example of how this stakeholder analysis might be completed for this partner. So Sunshine County Children's Health Coalitions, funded by the Food Resource Action Center. The impact this effort would have on them is that perhaps this aligned right with their policy priorities. So this would be a success for them. Their relevant powers might be advocacy resources and access to data, their network of partners, those could all be relevant powers. They might be accountable to their board of directors and influenced by their funders and funding priorities, and they would be supportive of this priority. So now we've taken stock, and I'm sure there's many more considerations here, but for the purpose of the example, let's say this is what we came up with. On the next slide, please. How do we make sense of this information? Once you have analyzed the various stakeholder organizations, the next step is to map them onto this power and support map. So this is a matrix of what power the organization has over the issue and what support they have, so partners or opponents. In the dark green box, those, as it says, are the partners who represent your strongest the people who represent your strongest partners, because they have power to influence and they want to see the same change that you seek. On the left side would be those to be aware of because they have the potential to derail your target. They are not in support of the issue, but they do have a lot of power to derail the efforts. So, and if you can click forward once, please. So I just did this exercise myself with this example to see where can we put the Sunshine County Children's Health Solutions. And I'm realizing it could be in, one of the boxes, top or bottom, based on their power. I'm thinking it would go, that star would go a little bit down into that this is, or maybe a little bit up. This is a group that would have some kind of power in our advocacy efforts for this change. They are diehard support of this effort, so we would absolutely want to engage them, but we know that there might be some other partners with higher power to impact who we would really want to get involved to see this change that we want to see. So the purpose of this last step is that it's helping you make meaning of all the information that you gathered about the stakeholders. And there's obviously here implications for how to engage them. So in a MAPP process, you would do this analysis for many different partners who could potentially be engaged in or impact the specific priority issue that you've selected. And we thought that this would be potentially a helpful tool to you all, even outside of community health improvement, as a way to break down that process of thinking strategically about who to involve on a priority issue effort. So just for brief discussion in the chat and closing to this, which of these elements about power would be the most helpful to you to explore with your partners or in relation to your partners? Which of these factors stick out to you as being particularly helpful? Influenced by alignment. Great, lots for alignment. Right, so sometimes just putting into very real terms and being very explicit about, do they want to see the same change that we want? That's a great way to just even begin that analysis of who to involve. And I'm in agreement also on influenced by. I think that's one, before working on this work that I had not thought about before, that even though you have a group that's aligned with your work, you have to think about who has sort of the ultimate veto power over their work. Because you could go as far as being totally on the same page with a partner organization, but they don't really have the say in actually working on that priority with you. They're influenced by decisions by their board, and that would maybe be a different change target. Great. Thank you all so much for and relevant powers. So thinking about different types of powers. Thank you, Becca. Yes. So really appreciate your input on that. As one additional resource that I wanted to highlight on the next slide. So what we just went over is a tool that you would use in that last phase of MAPP when you're planning how to take action on a specific issue. A different tool in MAPP that we just wanted to highlight is the stakeholder and power analysis. This is the very first step of MAPP 2.0 to help you determine who to involve in the broad process of assessing and planning to address community health priorities. The goals of the analysis are to understand the characteristics of all who will be impacted by or could have an impact on the community health improvement process. And second is to use that information to identify and build new relationships with organizations and community members. So it's very similar to and has overlap with the power analysis that we just went over, but it's intended for being used at the beginning of a broader process, like when you're bringing together maybe a new coalition with a broader goal of addressing community health. It's helpful. It includes because it includes some brainstorming activities to help you widen that table of who's going to be involved in your broader community health efforts. And lastly, just wanted to note the resources that we have available around MAPP. So at nature.org/MAPP, you can find all things MAPP related. We have the MAPP handbook and tools linked there, a link to the MAPP Network virtual community, which has 11 pre-recorded trainings about the different sections and tools and assessments of MAPP, open discussion board to post questions and respond to others' questions, and recommended webinars and tools from the field. We also have a series of regional trainings upcoming. So in March, we'll be in Cleveland, end of April in Albuquerque, and in mid-June in Portland, Oregon. And you can find all that information at nature.org/MAPP. But now I will hand it back to Molly, I believe, for our Q&A section. Thank you.
Awesome. Thank you very much, Anna. This was such a great overview of the MAPP 2.0 framework and resources. And it's really great to see how equity was incorporated throughout MAPP 2.0 in particular. I think to recap a bit, as you described, analyzing power is a key part of this work, and specifically understanding how it's leveraged in communities and whose power is being considered, and how this can play a key role in advancing particular policies and programs. And having you do that deeper dive into the power analysis was really interesting in thinking through who to involve to address priorities in health improvement planning, and how engaging these partners in this process can promote health and improve health equity. So really, really appreciate that. Thanks for all the great insight and all the great resources that you've made available here. I think we've put some links in the chat. So at this time, I'd like to move us along to our Q&A and group discussion. And I would love to start us off with a question that I have here for you, Anna. So a key part of our choices work is thinking through which partners are needed to put a particular policy or program, which we often refer to as strategies, to put them into place. And we often do this from the perspective of activities. So who leads, who participates, and what are the roles and costs that are associated with those. And we have a few new resources at Choices, our strategy profiles and strategy reports, as we call them, that kind of list out this type of information for various strategies that we have found have really strong evidence for improving health and health equity. And I'm wondering if you can speak a little bit about how that information around activities and resources that are needed kind of fit into the MAPP resources that you highlighted, and any tips or suggestions for how to engage partners to clarify their expectations and contributions to particular programs and policies.
Sure, thank you. So thinking about those tools in particular, I think that those would be helpful as far as helping you take an inventory of who has the resources that are needed to make progress, what their interest is in the work, maybe even partners as far as are thinking about what partners can provide those resources and how they influence those priorities that you've identified. So again, that stakeholder analysis is more at the beginning of a broader process like community health improvement, but you could kind of blend those tools in as a way to tailor your stakeholder analysis to see who can really offer these resources that we need available in order to address these priorities through these strategies, for example.
That sounds great. Thank you, Anna. Appreciate that. And I'll highlight, we put a few links in the chat to some of our resources from Choices that might be helpful that I was referencing before. So thank you, Anna, for that response. And I'm also wondering, kind of from everything that you've been sharing, it sounds like a really key part of the MAPP 2.0 framework is using your assessment findings to inform actions and planning. I'm curious about what kind of data or information can be helpful for engaging conversations with partners around analyzing power, and if there are any considerations around using data showing health disparities that would be helpful to consider.
Definitely. So I think even starting there, knowing where the disparities are and what populations are experiencing those inequities is going to be helpful for the power analysis to understand who's really impacted by this issue and by this priority. Another area where data can be helpful is if you're able to use the data, especially relating to social determinants and root causes, to determine what the root causes are of the challenge, might help you reframe who should be involved in addressing it by thinking about who and what systems are really contributing to the root causes of that issue. But really that data around health disparities, I think is going to be helpful for thinking about who to involve in addressing issues that impact those communities.
Yeah, absolutely. Thank you, Anna. Yeah, and thanks for highlighting the importance of identifying root causes in that issue. Appreciate that. So looks like there have been a few questions in the chat. So thanks, folks, for submitting those, and please continue to do so. I have a question here from Jesse. Thoughts for use of MAPP tools for planning beyond chip development, and any examples?
Yeah, thank you so much, Jesse. I think that the tools could absolutely be applied outside of community health improvement specifically. So if you were working with even a coalition that was focused on a more specific area, like healthy eating or healthy food access, for example, the tools could still be used to help you form a strong network of partners. There's tools in there around like how to form a steering committee and core group for that work and what the roles would be. So the tools are really used across this like large, broad process of community health improvement, but in a lot of ways could be tailored down to a more specific priority area that you're looking to address. The assessments are going to get you at more broader community health challenges, but there might be some indicators in there that are helpful to take a look at, or considering especially things like the qualitative assessment. And again, we have resources about this on our website, but seeing if you wanted to use any of the qualitative assessment tools to learn more about a specific priority area, for example.
Great. Thank you, Anna, and thanks, Jesse, for the question. Another question here I see from Joseph. Do you have any ideas on how to collect data that is more real-time to track chip strategies? A lot of the data he has is available is dated, so tracking if there's an improvement or not is hard to do.
Yeah, thank you so much, Joseph, for that question. And I know that that's something that a lot of communities face on getting that real-time data. I think that is something that we're looking into more as far as finding best practices for how to do that. But I think part of the thinking that goes into that is planning as you're developing the chip, having a really concerted effort on what data can each partner be tracking over the coming months and years that we could refer back on, rather than only relying on existing data sources, but seeing what kind of new data could be collected. I know that that's speaking more to the importance of your question than an actual strategy, but just to say, yes, lots of agreement in the field that that's an area where more tools could be provided, and appreciate you raising that.
Great. Thanks for that question. So once priorities for a chip have been defined, what are kind of the next steps?
Yeah, thank you for that. So to outline kind of where the rest of the process goes, so you've identified your priorities and figured out who you're going to work with to implement the chip. So really then you move into chip implementation. So dividing up the work among partners to Joseph's point, seeing what each is going to track in relation to the success of those strategies. And that data is helpful in your next cycle for understanding what the current issues still are and what strategies are working or not working, but you would carry out that process before moving into your next CHIP cycle and starting a new assessment.
Great. Thank you, Anna. Another question from Catherine, just highlighting the use of the word opponents, feeling a little bit anti-community. Have you found folks already using the tool who have maybe other words to use instead of the word opponents?
That's a great point, Catherine. Thank you for that. So I'll note that this tool comes from more of a community organizing and advocacy space. So I think that the word is used as a way to be very explicit about, we're talking here about who is going to contribute to the change that we would like to see, and those who are going to actively work against the change that we would like to see. So I agree with you, though, that opponents, when we're just talking about, say, if there were community members who didn't want to see a change in a certain way, but they're not necessarily this staunch opponent you could never work with, that might not be the best word to use. So I would definitely just welcome other suggestions from the group in terms of how you talk about community groups who are not in line. Maybe that's it, is not aligned, is a little clearer way to describe that, but appreciate you raising that as a consideration.
Thank you, Anna, and thank you, Catherine, for that question. I think also just in the same vein of just talking about language and terminology, Janae shared that potentially phasing out the use of the word stakeholder. And thanks, Janae, for sharing the link to some really nice language options for other language choices. I don't know if you have any comments or anything on that, Anna.
I'm so glad you mentioned that, Janae. I'm going to be honest, when I got to that slide, I remembered we usually include a disclaimer here because this is something that NACCHO has been working on recently in response to recommendations and an understanding of the fraught history of that word, to find something that is more positive and more related to who's going to be, really what we're trying to get at is who's impacted by this issue and who could have an impact on it. So appreciate you recommending collaborators and sharing that resource and elevating that. And I know at other programs at NACCHO, they have phased out the use of the word stakeholder, and we're working on that now for MAPP. So thank you for that.
Thanks, Anna, and thank you, Janae. Yeah, certainly our use of language and communication is a really important aspect of all of our collective work on health equity in particular. So I really appreciate those thoughts. Another question here from Ari. At Johnson County Public Health, we have 4 priorities, and we've completed the power map, but we've identified several community partners that have power in more than one priority area. Do you have any thoughts on how to choose which partners should participate in the subcommittees without burning them out?
Thank you, Ari. Wow, that's so interesting to hear about, and that's a great point, because serving on 2 or 4 subcommittees and having overlapping work could be really overwhelming. When I think of this question, I think of how it gets to like thinking about root causes and, why is it that one partner has impact across multiple areas? Is there a social determinant or a different root cause that's really driving all of those priority areas? And not to suggest altering your CHIP, but just something, to think about is maybe, is there an opportunity to involve that partner on one area of broader cross-cutting work that is going to trickle down to the different priority areas? And maybe the responsibility is on the other subcommittees to kind of plug in with that, as opposed to putting the responsibility on that one partner to contribute often the same things across the priority areas. But would love to hear what others think about that too. That's a great question.
Great insight. Thank you, Anna. Thanks for that question. Jesse has another question here. So beyond the broad trainings on MAPP, Jesse's curious, does NACCHO provide direct technical assistance to local health departments? And do you help design prioritizing processes for specific health department programs?
Yes, so thank you so much, Jesse. So I'll put our MAPP email in the chat, map@nature.org. If you have specific TA requests, we do have some grant funding to provide direct technical assistance. We might start with a 30-minute to 1-hour phone call or Zoom call to learn more about the work that you're doing, challenges you're having. Nature can do things like document review and make suggestions on your process. So please do reach out with those types of questions. We do a little bit less on the facilitating of the CHI process side and more on the advising side. But we do have our consulting arm at NACHO who provides more fee-for-service work, and that could be an area for something like that too.
Perfect. Thank you, Anna. Another question here, and my apologies if I'm not going to pronounce your name correctly, but maybe Akua is asking, the CHIP process is typically a 3 to 5 year cycle. Do you have any ideas on how to keep community partners engaged throughout the process? Great question.
That is a great question. And yes, it is a long cycle and then it's repeated. I think that when it comes to engaging community partners, I think for today, one thing I would highlight is thinking about what your overall shared goal is. That might be a long-term goal or medium-term, but something that is beyond just what you're looking to do in this 3 to 5 year cycle, but like where do we as organizations align in our vision of where we're headed together so that working on that vision ideally trickles down into the work of each organization. And then as people leave each organization and there's turnover, there's still that work on the shared vision together is one consideration. But then also would just point to other things, that I'm sure many of you know and have, or all of you know and have experience with, as far as the importance of building those really valuable, close relationships with individuals at other organizations, so that it's less of what can the organizations give to us in our health department CHI process, and more, building that like ongoing trust and partnership. But of course, that takes time and is challenging to do as well. That's a great question.
Great insight. Thank you, Anna. I think we have a couple other questions here, and then we'll get close to the end here. But Joseph had another question on advice on how to get partners to share data. So, for example, in our county, we have multiple school districts, and only a couple will share data with us. But if we could get access to at least some of the school's data, we'd have a lot of great insights into different communities. Seemingly hesitant to share things. So, any advice or tips on that?
Thank you, Joseph, for that question. I keep doing this, but it's another one that I think would be great to hear from others in the group who have more of this experience of working directly with school districts in that way, for example. But I think similar to what I was saying, I think what we would recommend from like the MAPP or NACHO perspective is figuring out where the intersection of your work is, where them sharing the data is also, is going to be helpful to the community health improvement process, which is also going to be helpful to their goals. So finding like, what is our shared overall goal? What can we offer you in this process that will be helpful to your work? And in return, what kind of data could you offer us in return? A very kind of simple, approach to thinking about that, but I really appreciate you raising that. You all have some really great questions, and it's very interesting to hear about the more specific work that you're doing. So thank you for sharing this.
Great. Thank you, Anna. And thanks, everyone, for really excellent questions. So I think there's one question here I'd love for you to address, Anna, but I think also I know we do have a poll that we wanted to check in with the group here on. So I'll let you go ahead and launch that poll.
Yes, just wanted to ask this question of the group, if there's things that you'd be interested in learning more about in a future session related to MAPP. You can select multiple, but in 3 kind of big chunks here. What is your interest in identifying strategies to target social determinants of health and root causes versus sharing power with community members through a community-wide process, and tools to gather mixed methods data about community health?
Great.
And I can respond to Becca's question here about power. So the question is, seeing that power sharing is mentioned in the Power Primer, which I did not mention, but is another tool to check out on our website. And do we have guidance on how to manage power imbalances between people and organizations that will likely be identified in the process? and are the health department's collaboratives that have done a particularly good job of this. So thank you for noting that, Becca. So yes, the purpose of the Power Primer tool, it is a supplement to the MAPP process, and it outlines 7 practices for how you can address power imbalances as a root cause of health inequities, but it's really with that really looking at how do you address power in the room so that through a MAPP process, you're contributing to building community power as opposed to keeping all the power and decision-making over the process with a very small group of individuals who are involved or organizations who are involved. So there's many tips and tools in there. We developed that with human impact partners as well. So lots of tools in there as far as addressing power through the process. And I would say it is a tool that is still being, starting to be used as we just released it last July, but you might be interested in looking at human impact partners, other work with local health departments to see examples of health departments who've done that work with human impact partners. And on the poll, okay, it looks like there's interest in all 3, almost equal, which is great. So this is helpful to know in terms of additional areas of MAPP to explore that might be of interest to you all. Thank you so much.
Great. Thanks, Becca, for that question. And thank you, Anna, for your response. And thanks, folks, for weighing in there on the poll. That's great. And I think some folks have been chiming in the chat back to the earlier question about data sharing. So appreciate folks weighing in on their experiences. We love to see that engagement. So thank you. So we like to wrap up a little bit earlier than the top of the hour. So I'm going to just ask folks a few things before we move on today, but we do love to kind of collect a sense from folks at the end of our coffee chats on something that you learned today, or maybe a new resource or tool that you're really excited about that you're going to take with you from the chat today. So want to encourage folks to share your thoughts in the chat about that. We always love to hear. And I just want to say thanks, Anna, for terrific presentation and for answering all of these great questions. Thanks to this group for asking really engaging questions. So a couple of quick notes here before we close. We always like to ask folks to share any ideas that you might have for topics for future coffee chats. So please feel free to share in the chat. We also would like to share a reminder, we do have additional resources and tools from Choices available in our Community of Practice portal. So you can register to be a member to access those resources, and there is a link in the chat that you can follow to do so. We also tend to have a little post-event survey that will pop up as you leave the meeting today, and we really welcome your feedback and experiences. So please let us know what you think. And we will be sharing the recording and the slides from today's session on our website. So be on the lookout for that. We'll share that via email. And our next coffee chat, as you can see on the slide, is going to be Thursday, March 28th at the same time, 1 p.m. Eastern. So we hope to see all of you with us again. And thanks again, Anna. We really appreciate having you come on and talk about your work at NACCHO and the MAPP framework and all the great insights and tips. And we've really been fortunate to have you joining on our Community of Practice coffee chat discussions. So thank you, Anna.
Thank you all so much for your engagement in the activity and discussion. That was fun. Thanks for having me.